Hello guys, again welcome back to my channel. So I am Rohit from certified professional coder and registered pharmacist. So in this video I will discuss anesthesia coding guidelines. So don't skip the video. Then start. Anesthesia code range between 00100 to 01999 with include anesthesia modifiers. Anesthesia service provided by anesthesiologist, anesthesia assistants or qualified non-physician anesthetic. Then type of anesthesia: general anesthesia, regional anesthesia, local anesthesia. Then anesthesia services, then preoperative and postoperative care, administration of fluid and blood, monitoring service that include blood pressure, temperature, ECG, oximetry, mass spectrometry and capnography. Then anesthesia exclude services like central venous, intraarterial, sanguine. Anesthesia include services and exclude services. These examples are come exam in MCQ, so don't forget to read this point. Then next point, anesthesia coding guidelines. First I will discuss anesthesia time unit. Anesthesia time unit are depend on start time and end time. Start time from the anesthesiologist being to prepare the patient for the induction of anesthesia opening room, and ending time, the anesthesiologist is no longer in personal attendance. The patient may be safely placed under postoperative supervision. Then how to calculate anesthesia time? Each 15 minutes means 1 unit. 1 unit means each 15 minutes. For example, a 45-minute procedure, it is in 3 units of anesthesia time. As like you can calculate the unit in anesthesia procedures. Then next point, discontinue time. There are some interruption in anesthesia care during a procedure. If the provider is no longer personally attending the patient, schedule be recorded correctly about the interrupting timing. For example, the anesthesiologist being care at 9 are interrupted at 9.25 minutes and resume at 9.30 minutes, ending care at 9.55 minutes. There would be 50 minutes of anesthesia time. This would be 3.3 time unit. Then anesthesia modifiers. For anesthesiologist, A means anesthesia service is performed personally by anesthesiologist. Then QY means medical direction of qualified one physician assistants. Then QK means medical direction of 2 or 3 or 4 concurrent anesthesia procedure. Then what is AD? Then AD means medical supervision by a physician more than 4 concurrent anesthesia procedure. Then non-physician anesthetic, that is QX and QZ. Then QX means qualified non-physician anesthetic service with medical direction by a physician. Then QZ means qualified non-physician anesthetic service without medical direction by a physician. That is difference only with medical direction physician, and QZ means without direction physician. Then MAC means monitored anesthesia care, that include QS, Q8, Q9. Then QS means monitored anesthesia cares, can be billed by qualified non-physician assistants or anesthesia assistants or physician. Then Q8 means monitored anesthesia care for deep, complex or complicated surgical procedure. Then Q9 means monitored anesthesia care for a patient who has severe cardiopulmonary condition. Then you can use G9 modifier. Then physical status modifier. Physical status modifier include P1, P2, P3, P4, P5, P6. Then what is P1? P1 means a normal healthy patient. Then P2, a patient with mild systemic disease. Then you can use P2 modifier. Then P3, a patient with severe systemic disease. Then you can use P3 modifier. Then P4, a patient with severe systemic disease, that is constant threat of life, that is P4. Then you can use P4 modifier with unit 2, and severe systemic disease with unit 1. Then P5, that is a moribund patient who is not accepted to SARA without the operation, that unit 3, that is P5. Then P6, a declared brain dead patient whose organs are being removed for donor purpose. Then you can use P6 modifier. Then for example, a patient has hypertension. Hypertension is mild systemic disease, not severe disease. Then you can use P2 modifier. Next example, a patient has uncontrolled DM. DM means diabetes mellitus. That is severe systemic disease. Then you can use P3 modifier. Then last point in anesthesia coding guideline, that is qualifying circumstance. That include total 4 codes. That codes are 99100, 99116, 99135 and last 99140. That is 99100. Anesthesia for patient of extreme, that is 1 unit of anesthesia. Then you can use 99100. Some extension code are 00326, 00561, 00834, 00836. These procedures are performed on infants younger than 1 year of age at the time of surgery. This guideline be very important. Then next code 99116. Anesthesia complicated by utilization of total body hypothermia. Any hypothermia procedure in anesthesia coding, then you can use 99116 add-on code. Then next 99135. Any complicated by uncontrolled hypertension, then you can use 99135 add-on code in anesthesia coding. Then next 99140. Any complication by emergency condition, then you can use 99140 in anesthesia coding. So there are some important abbreviations. That is CRNA. CRNA means Certified Registered Nurse Anesthesiologist. Then SRNA, Student Registered Nurse Anesthetic. Then MAC means Monitored Anesthesia Cares. These all guidelines are be helpful for anesthesia coding. So more anesthesia coding serious question available. So who want to need, WhatsApp me. I will share you questions plus CPC exam preparation notes. So any query regarding any question, comment me and don't forget to subscribe my channel.